are confusing. No one really gets you ready for what they'll be like, and many of us end up finding out more about what is normal from talking to our friends at school than from any real reliable source. So let me break it down for you. I am Brooke, a gynecologist, and today we're going to become an expert in understanding our own periods. We're going to break down what a normal period looks like, when irregular periods can be considered normal, how much pain or bleeding is too much, and of course when you should be seeking help. So first, let's talk about what is a normal or a typical period, as I like to say. It means that your cycle lies within the range of 24 to 38 days. It also involves your period lasting for less than 8 days, so most people bleed for about 3 to 5 days, but anywhere from 2 to 8 days is actually considered normal. There also shouldn't be a big difference between your shortest and your longest cycle, so it's easier if you've been tracking them for a while, it'll calculate the length of your cycle. But there should be less than 20-day difference between your longest and your shortest. Also, if your period is normal, it means that it doesn't interfere with your ability to do your usual activities. They're not too heavy or too painful to mean that you're not able to go to school or to work. So even on your heaviest days, you can still do your normal activities. So if you fit all of these categories, your period is normal. But many of us might find that 1 or 2 of those parameters might sit outside the normal. Those parameters are pretty similar across the world because they come from the FIGO recommendation. Now, the common question is obviously how heavy is too heavy, but it's important for us to know that the amount of blood that is lost during a period can vary, but on average, women lose between 30 to 40 mils of blood per period, but anywhere from 10 to 80 millilitres is considered normal. More on how you can work out how much you're bleeding in a bit. So first up, irregular periods. When is it normal? Now let's discuss irregular periods because it's quite common to have irregular periods, especially during the first few years when your periods start. And this is because your body is still adjusting. It can take time for your ovulation to become regular, and obviously it's only when you ovulate that you see a period. So if you don't ovulate every month, you have some months without ovulating and ovulatory cycles, you won't get a period every month if you're not ovulating each month. In fact, up to 30% of young women experience irregular periods during their teenage years. So if you've only just started your periods, it's completely normal for them to be totally unpredictable for the first 2 years, but it can even take up to 8 years before they become predictable. That being said, irregular periods can be very annoying, so you can still talk to your doctor if it is bothering you, but be assured that if you are in those first 8 years from when your periods have started, it's likely to settle over time. There are some other common causes of irregular periods, and these include polycystic ovarian syndrome. And this affects about 1 in 10 women of reproductive age, but it's important to note that we don't diagnose this condition until you've been having your periods for around 8 years. And when we do make the diagnosis of PCOS, the diagnosis is made as a combination of your symptoms. So if you're experiencing any excessive hair growth, acne for example, as well as blood test results and ultrasound scan. There are other reasons for irregular periods. So for example, if you've got extreme weight changes, if you do significant amounts of exercise, if you're stressed, if you have thyroid problems. And stress can actually manifest in different ways. It's not just like, oh God, I've got a big coursework coming up. It's also the emotional stuff. It can be traveling. So when you're changing your time zone a lot, can cause you to have irregular periods. It can also be stresses on your body, like having a vaccine. So when your immune system is responding to a new immune challenge, that can make your periods irregular. A lot of people found that during COVID times, for example. So you can have a few months of irregular periods that settle back into a regular pattern. There's other causes of irregular periods that might not be temporary, but if you aren't trying to get pregnant, then having unpredictable periods is not necessarily something you should be too concerned about. However, if you're not on any hormonal medication, it is important that you should have a period at least every 3 months, because otherwise the lining of your womb can continue to get thicker and thicker, and that can be risky if it's left long term. If your periods are very infrequent, it's worth discussing it with your doctor to see if there is any cause, and also if there's anything that they can do to bring on a period or to make them more regular, to keep the lining of the womb thinner. So keeping track of your cycle, for example using an app or a paper calendar, old-fashioned way, can help you to understand your patterns better. If you do notice any significant changes, like your periods becoming much more frequent or much less frequent, or if you've got other symptoms like excessive hair growth, acne, weight gain, these are all good reasons to check in with your doctor. So next up, painful periods. How much pain is too much? So we've got hormones like prostaglandins, which help your uterus to contract and shed its lining. And these are responsible for the cramps that you might feel in your abdomen, your back, your thighs. Normal or typical cramps can last for about 1 to 3 days, and they should be manageable with over-the-counter pain relief medications like ibuprofen or paracetamol. However, if your period pain is so severe that it interferes with your daily life, it might not be normal. Severe period pain that prevents you from going to school, going to work, or can't be managed with that regular pain relief should be discussed with your doctor. Also, if you have got some pain and you've had several years of no pain with your periods and now you've got pain, or you've got pain that happens at other times of the month, or symptoms like painful sex, rectal pain, these can be suggestive of an underlying issue like endometriosis or pelvic inflammatory disease. Endometriosis is more common than we think and can cause severe pain and other complications. So essentially, yes, a little bit of pain and cramping that can be resolved with a bit of paracetamol is kind of normal, but any pain that is interfering with your life, no matter how severe, you should speak to your doctor because there might be another reason why you're having so much pain. Okay, now let's think about flow. So how much is too much for your heavy period? A normal period, as I mentioned before, involves you losing around 30 to 40 mils of blood, but you can imagine that it's nearly impossible to measure your own flow and to compare how much menstrual blood you're losing. Possibly the only way is if you use like a menstrual cup, you might be able to tot up all the amounts every day and work out your total flow. But either way, it doesn't really matter. What matters more is to know if you have a heavy period is if you find yourself changing your sanitary products every 1 to 2 hours, if you do pass large blood clots, if you find you have to wake up in the night in order to change your pads or your period underwear, for example, or if you bleed through your clothes or your bedding. These could all be signs that your periods are more heavy than normal. Heavy menstrual bleeding, also known as menorrhagia, can be caused by conditions like fibroids, endometrial polyps, or thyroid problems. And studies suggest that actually about 1 in 5 women experience heavy menstrual bleeding at some point in their lives. So if your periods, again, are heavy enough to disrupt your life, you don't have to just put up with it. Your doctor can determine if there's an underlying cause and what treatments you have and what treatments there are that could help. So there are treatments that range from hormonal treatments like non-hormonal medications like mefenamic acid, hormonal medications, to even surgical options depending on the cause. Okay, so who should you see for help? Well, if you're experiencing severe pain or heavy menstrual bleeding or significant changes and irregularities in your menstrual cycle, it's important you do see a healthcare professional. You can start with your general practitioner or your family doctor depending on where you are in the world, and they can then refer you to a gynecologist if needed, but often they can actually start some treatment for you there and then. They might do a pelvic examination, they might request some blood tests, or they might just suggest some imaging tests like an ultrasound scan to help them understand exactly what's going on. Remember that tracking your menstrual cycle and any symptoms that you're experiencing can provide valuable information to your doctor. So don't hesitate, do seek help if there's something that just doesn't feel right. For far too long, we have just been dismissing period problems, or your mum or your sister saying, yeah, it's just like mine. But actually, there is a lot that can be done to help you. So thanks for watching, and I hope this video helped you to understand what is normal or what is typical when it comes to a period and when you should seek help. So if you've got any questions that you'd like me to cover, leave them below, and don't forget to subscribe for more content like this.